A story that's coming your way is one that will make you question whether the social policies and interventions towards poverty eradication in Ghana are really yielding any results. Tonight, Nabil Ahmed Rufai takes us to Offini in the northern region, a community that has existed for almost a century without electricity, basic commodities or basic amenities, schools and health facilities.
Offini is so remote, it takes a 3-hour drive from the capital Tamale after you touch down by flight and drive on roads that are really nothing more than just tracks in the sand. It is 13 hours by road if you make the journey from Accra. Offini is a sparse community in the Gushegu municipality of the northern region. Just before entering the community, I come across children wandering about barefooted, shabbily dressed, and looking highly malnourished. I meet up with chief of the community, Mohammed Offini, on his farm. The community was named after his late father, who was the first settler.
The only activity here is farming. Due to lack of schools here and nearby communities, the children are unable to acquire education. Many of the youth here marry early.
The harsh reality of poverty is seen through the household of the chief. He has lived here all his life and fears nothing good may come out of his 18 children if they continue living here. And the reason is obvious. These children, from the youngest to the oldest, have never stepped foot in a classroom before because the community Offini has no school. Now the children grow up and end up becoming farmers and can neither read nor write. Data from the Statistical Service shows that as of the 2010 population census, Gushegu municipality with over 100,000 people had 111 schools. 24 are kindergarten and nursery schools, 74 primary schools, 12 junior high schools, and only 1 senior high school. There is high fertility rates among the women in Offini, who have an average of 6 children each. Gladys is pregnant with her 3rd child and says lack of a clinic in Offini makes it difficult for women in her situation to deliver safely.
During emergency cases, pregnant women find it difficult getting to the hospital in Gushegu. It is far from here and this causes a lot of complications.
The result of high birth rate in Offini is the increase in poverty level in the community, and children are the most affected. The Ghana Poverty and Inequality Report released in 2016 showed that the northern region saw its high level of poverty fall only marginally from 55.7% to 50.4% in 2013. Also, a 2016 report by Overseas Development Institute on Child Poverty, Inequality and Demography has revealed that children in Africa will account for 43% of global poverty by 2030. An increase from the 25% in 2015. Mma Offini is wife of the late Chief Offini, the first settler in this community. She says it is very depressing seeing generation to generation living here and deprived of the basic needs of life.
I feel the children here are losing out. Many years have passed without any development in Offini, and I'm sad their life is even worse than when I was young.
Imagine the new chief's shock when, as a young man, he made a trip to the northern regional capital Tamale in 2011 and saw what you would even term abysmal development. Mohammed Offini could not just wrap his mind around what he saw in Tamale compared to his little corner in Offini. His mind was boggled.
I
was really surprised seeing the big houses in Tamale. We can't have that in Offini. It's too much for us.
Despite that, he only wishes they would get a school to educate their children and escape their extreme poverty. Also, a clinic and electricity for the village would be a good addition. That's all he asked for, not the big houses in the city. Chief Offini's household falls within the extreme poverty bracket because they live on less than $1.25, the equivalent of 5 cedis 80 pesos a day. The harsh living conditions in Offini smart the global efforts towards achieving the Sustainable Development Goals on eradicating poverty, hunger, good health and well-being and quality education by 2030. Countries like Ghana may not achieve the target if a radical approach is not adopted. For when dwellers of impoverished communities like Offini gather, they only take solace in drinking alcohol to ease the pain of being deprived the basic needs of life. The vicious cycle of poverty seems to have no end in Offini. It's a tough life here in Offini, a community cut off from what you may call civilization. The community has existed for so many years without electricity supply, no healthcare facility, and even schools. And when it comes to putting food in the stomach, this is a typical supper for these children. Highly not nutritious, but this is what they have to contend with every day. So after this supper, they will go to sleep, wake up the next day, and the struggles of life continues here in Offini. Nabil Ahmed Rufai, GH1 News.
Let's come straight to our interview for tonight. I'm talking to Dr. Felix Adoyobo. He's a Director for Development Policy Division of the National Development Planning Commission. You're welcome to the studio.
Thank you very much.
Now, I don't know if you were able to appreciate that story, but I'll just summarize it.
Sure.
So my former colleague, Nabil, visited a number of communities in the 3 northern regions a couple of months ago. And he was looking at poverty. He was focusing on poverty. He visited quite a number of communities. And the bottom line is that so many of them are living on less than $1 a day. It's not the first time you're hearing this. There are no schools in the community. So for so many years, no one in some of these communities has ever sat in a classroom before. No electricity. They have corn, boiled corn for supper. They wake up in the morning, there's nothing to do. One family has 18 children. We can understand why they are having too many babies. They trek miles to access health care. We have political parties that campaign for votes, and they spend so much money on manifestos, and they tell us what they are going to do to turn around the fortunes of Ghanaians. The sad story is that these people do not have anything, but in election years, we find a way to get ballot boxes there. How does the National Development Planning Commission feel about this?
Thank you very much. This is a situation that we are not proud of, and we are very much aware of the statistics, the various dimensions of poverty countrywide, the disparities between the north and the south. So I'm not surprised your colleague went to the north and saw a very appalling situation among Ghanaians. In the south, it's slightly different, but even in urban areas, there are pockets of people living in extreme poverty.
In my region, in the central region is very poor, extremely poor.
Yeah. And so that brings to the fore the issue of how do we measure poverty? How do we track it? How do we disaggregate the numbers so we can have effective targeting of interventions to address the issue of poverty? And in that regard, various governments have been doing their bit to bring down the numbers, but like you rightly said, the numbers are still high, and we need to be concerned about the numbers.
Now, we brought you here from the NDPC for a reason. Chief amongst them is how political parties situate their manifestos in the bigger picture of national development planning.
Yeah. How
do they do it?
Right.
Do they ever do anything in concert with the NDPC?
We do, some political parties, I should say, do have consultations with NDPC on a range of issues, and that gets that reflects in their manifesto.
Okay.
And then also many political parties, as part of the process of preparing their manifesto, do go around the country and do consultations, and then tease out what they think are the pertinent issues that needs to be addressed, and that gets fed into their manifesto. But there's this chronic problem that we have, that as a country, we don't have a sort of blueprint that binds political parties or anyone to follow.
What would it take to have this blueprint?
It will take Ghanaians demanding for it.
Okay.
I think that is the bottom line. If we shout,
so at the moment we are not demanding.
I think here the demand is not high enough, and we need to push. There need to be a drive. Interestingly, as part of the constitutional review process, there was a strong call for a national development plan that is binding to successive governments, but like you know, that has not been followed through.
Yes. And so, I mean, you're talking about people demanding. What I find frustrating and disappointing is that we have communities that are living in such poverty, experiencing such levels of poverty, and the levels are quite sensational. And you would think that they will be at the forefront of the demand, but it doesn't happen. Does it surprise you at the NDPC?
It doesn't surprise me because being able to demand something very much depends on your awareness and your knowledge about the situation, and then even where to go to make the demand. And in many instances, those in the deprived communities, like we say, don't even have a voice. So they can't articulate their views, they can't press for their demands, and this is where civil society organizations come in to help give a voice to the voiceless, and maybe to chip in. The fight against poverty, yes, it should be government-led, but we all have a role to play, especially because of the multifaceted nature of poverty, civil society, private sector, faith-based organizations, the media need to create that awareness and what it takes to lift people out of poverty. Then together we can achieve our aim of reducing poverty.
So on a day like this, when we are all talking about poverty, what does the NDPC say? Looking at where we are and where we could potentially be.
Yeah, right. So what the NDPC is saying is generally poverty has been on a decline, but not at the rate that we expected. And we've done some studies and looked at the data, and we've identified some of the root causes of poverty, especially the multidimensional nature of poverty. And government has already started taking some action in this area, that poverty, addressing issues of poverty should be multi-sectorial, and then also involve multiple stakeholders like the private sector, civil society organizations. So some initiatives like the LEAP, for instance, is helping addressing people in extreme poor households.
These communities that Nabil visited have never heard of LEAP.
Great. Probably not surprised, but LEAP,
it doesn't surprise you?
Yes, because the figures we have shows that the coverage of the LEAP program is not as we would want it to be. So it's the program is still being rolled out, and unfortunately some are benefiting, but probably a lot more are not benefiting. And it's all part of the process of effective targeting of those who are poor, and even how to get people don't become eternally dependent on LEAP, but graduate on and become independent on themselves.
Okay, before I let you go, on a day like this, and it's appropriate to ask you this question today, we know what happened with your original plan.
Which plan?
The plan, the NDPC plan, the 70-year plan that the 40-year plan that you had. What has become of it? How are you engaging the current administration and successive governments to focus on a plan to lift Ghana from where it is now to a proper place? Right.
So the draft plan was completed before the end of the last election, before the last 2016 year, and was presented to the new administration where they assumed office. They set up a team to review the document and make comments and suggestions on the way forward. That report has come back to NDPC, and NDPC, a team from NDPC is currently incorporating the comment into the report and updating it and then that will be submitted back to Cabinet for consideration.
Long process, isn't it?
Long but necessary process.
Long but necessary, huh? Thank you very much, Dr. Felix Adoyobo, the Director for Development Policy Division of the National Development Planning Commission.